Good afternoon, everybody, and welcome to QPS TalkTime. We're delighted that you can join us today, and we have a really exciting session on creating networks for patient safety. Just to say, in terms of our session, there are a lot of resources that are available for you. So you'll see there we have the Q community that you can join and you can access. The Quality and Patient Safety Matters is our newsletter, and we have a new one coming out very, very shortly. And we hope that you'll enjoy that. There's some really good articles in that. The Prospectus of Quality and Patient Safety Education and Learning Programs. And at the moment, when such a significant focus is on quality and patient safety, there's a lot of really good resources and training programs there that you can participate in. They're free, they're accessible to anybody, and just have a chat with your line manager if you're interested. A lot of them are online, so they're very accessible. And then we have a podcast series as well, Walk and Talk Improvement. And our most recent one was with Helen Bevan. And many of you will have come across Helen in the work that you're doing. If you're involved in improvement work, there's a good possibility you've heard of her. It's a really insightful one, so do take a listen to that. And just to say as well, the next one's coming out. So we have two coming out in our next set of podcasts. We have two on sepsis, so one for the members of the public and one for healthcare professionals, and that will be released in the near future. Okay, you can follow us on social media, so QPS TalkTime at National QPS, and we also then have the National QPS Directorate LinkedIn account, and we're using LinkedIn a lot lately because Twitter, I think, has changed its dynamic a bit, so we're using LinkedIn a lot, and you'll find a lot of our resources there. In terms of our panel today, we have, as I said, three wonderful speakers, and we'll introduce them in a moment. But in terms of our session today, we're going to hear about how to support integrated care pathways through network weaving. And a lot of you might be wondering, what is network weaving? That's what we're going to explain today. So we'll learn what a network weaver is and how to get started. And we'll discover how to create safe spaces for psychological safety and effective collaboration. And most of you that have joined us over the last while will know psychological safety is a fundamental of any of the quality and patient safety work we do. It's essential. We can't have conversations without it. So we're going to touch on that a little bit, and we'll understand the ripple effects of small but consistent network habits. So without further ado, our three speakers. So we have Joriam Ramos, who is a Q community convener. We have Hilda Campbell, who's an MBE and a CEO with COPE in Scotland. And we have Dr. Maureen Flynn, who many of you will be familiar with, and Maureen is a Director of Nursing and QPS Lead. And many of you will have seen the posters where you'll see the bio of each of our speakers, but between them they bring a wealth of experience and knowledge to our session today. And I'm Juanita Guidra, I'm a Programme Manager with the NQPSD. I'm one of your co-hosts, and also then Dr. John Fitzsimons. So let John introduce himself when the time comes, but welcome to our panel and to you, our participants. So we might get started. So without further ado, I'm going to pass over to Hilda, and I'll pass up the presentation here. So Hilda, would you like to tell us a little bit about your work?
Thanks very much, Juanita, and thank you everyone for having me along today. And I'm sorry that I'm a disembodied voice, but there's a wee picture of me in the corner, so that's what I look like. So today we're going to look at how to be an effective network weaver. That's a photograph of June Hawley, who back in 2011 put together the Network Weavers Handbook. And in the chat, there'll be a link to networkweavers.com, where you can sign up to a free newsletter that gives lots of information about networks and collaboration. But to give a sort of context of, so what is this network weaving and what makes it different from other times when we get together? So sometimes we go to a meeting and we call it a network, but it's not really a network, it's a meeting. People come together for a particular purpose and usually for formal discussion, and it can be quite hierarchical. So depending on the resources an organisation have, the position somebody has within the system, then their influence on the agenda may be greater than others. Then we can have a forum, which again, sometimes people call it a network, but nope, it's a forum. And that's where people come together and exchange ideas or views on a particular issue. Then we do talk about networks, which is a group or system of interconnected people or things, potentially building effective relationships towards a shared goal or to build a movement. And sometimes we think, well, maybe this is just me, but sometimes we think we're in a network and we put a lot of energy into it, but really we're in a meeting or we're in a forum or we're going round in circles and we don't really seem to be finding a way out the trap. This is where network weavers come in and network weaving. This is carried out by people who take responsibility for helping the networks around them become more effective. including other network members to become network weavers. So I sometimes describe it as a bit like you're banging into a wall trying to find the door. There's a lot of energy, a lot of enthusiasm, a lot of ideas about what we can do about X, Y, and Z, but a lot of banging into walls. And what network weaving offers is a set of tools, resources, and ideas that can build our capacity to help find the door, or if the door doesn't exist, create the door so that we can actually take ideas into action and actually make things change, but in a collaborative way where all voices are heard. Because a big part of network weaving is about we come as individuals. We may have other skills, resources, positional authority that we bring with us, but when we come together in that context, we come together as human beings wanting to make a difference. So what it offers is a different way into how to relate to each other. Huge long story cut and short. My professional background is mental health nursing. So many years ago, I saw a promotion within a psychotherapeutic day centre, and I thought, oh, I'll have a bit of that. That looks good. I think I would find that very rewarding. So I was interviewed. And at the interview, I was asked, how do you feel working in an environment where everyone's a charge nurse? I kind of looked. I was like, oh, I don't really understand the question. I was like, well, I don't understand the question. So it was like, well, there's no staff nurses. Everyone's a charge nurse. I was like, oh, you mean the hierarchy? Now, the director of nursing services was on the interview panel. I was like, oh, I've got nothing but contempt for the hierarchy. I was a lot younger then. The director of nursing services put his head in his hand and kicked at me through his fingers. As I said, I should probably qualify that, shouldn't I? With him giving me a very vigorous, yes, you should. I was like, okay. So I had a lot of experience working with older adults who were quite frail. So you could have a lowly nursing assistant who on a daily basis is supporting vulnerable older adults at risk of pressure sores and has a really, really good idea about something that would help reduce the risk of pressure sores. But they're only a lowly nursing assistant, so who's going to listen to them? Then we could have a director of nursing services who's not been anywhere near direct service delivery for a long period of time, who has a very bad idea about the treatment of pressure sores, prevention of pressure sores. Because of the director of nursing services, we all have to do it. And that's the kind of thing with network weaving. It's not being disrespectful to the positions that people hold within systems, but it's the recognition that be respectful to everyone in a system because they too have a voice that is worth listening to. And when we're talking about integration, we're talking about patient safety. That includes listening to the voices of people receiving services, carers, people directly delivering services. All those voices count. And it's how we celebrate that difference, because sometimes it can be a bit threatening. And network weaving is, how do we bring these diverse stakeholders together in a way that they can support each other, nurture each other, and it doesn't become conflicting? Because sometimes that type of work can be challenging. Network weaving offers spaces to be challenging, but a psychologically safe space. And a challenge or a plus is that it's moving away from a control. This is the way it will be, dictated by the one or two, to this is what the collective are working towards, which in the long run is a lot better for taking ownership and sustaining change. So relationships matter. And really, how often do we get to be our authentic self? There's a really interesting article someone sent me recently, and one of the secrets of a long and healthy life is being your authentic self. And yet, how often do we find we can't be that person because of fear of censure, judgment, not fitting in with what it is that we're supposed to be saying, because our position, it might be it's, well, if we say that, it might be the thing, it's my department saying that as opposed to me saying that. So building those relationships as human beings, being respectful of difference, being respectful of diversity, being kind to each other, but being open to look at the world through a different lens takes us out of the echo chamber. And when we move out the echo chamber, we just might start hearing some new things that we think, didn't think about that one before. The little infographic that's at the side there is a really helpful tool for anything you go along to where you're working with others. If you're the kind of person who finds they put their hand up quickly to say, I will take responsibility, realise sometimes it's okay to be curious, take a step to pause. If you're involved in a network, what is my role in this network? Why am I here? What's the expectation of myself? What's my expectation of others? And there'll be a little link in the chat box that tells you more about that tool. But it really is very important, because part of relationship building is about meeting each other's expectations. And we might, with the best will in the world, say, I'll do that, but then don't have the time to do it. And then people feel let down because we're committed to something that we couldn't do. So it's better we actually are honest and say, I'm really interested in that. It's going to be a couple of months before I've got the time to invest some time into it, but it's now in my forward planning that I'm going to look at that. And that's what I mean by being our authentic self. None of us are machines, none of us are robots. We need to be kind to ourselves and kind to each other, because that's what helps make the difference. On that note, this is a little infographic that we put together about measuring the energy levels in your network. And again, the link to more information on this is in the chat, because I'm really keen, although this is a brief session, to offer you tools to take away to use in the context of your own communities and environment that's helpful. And it's really just a thermometer from 0 to 10. Where 0 is the network members just don't have any energy at all, to they've got loads of energy. And it's a good thing to touch in with at the beginning of a meeting, a network meeting, a forum, any collection of people coming together. Where's the energy in the room today? Because if the energy's sitting at 1 or 2, people don't have the capacity to take anything else on. Because sometimes it can feel like we've not really managed to embed the last big idea before we're being hit with another 5 new big ideas. So monitoring our energy levels, looking at where we spend it, how we top it back up again, is good for us, but it's also good for working collectively. This is a slide that was put together following an event of a QI alumni conference last year in Scotland, looking at the power of the network for transformational change. And when we're thinking about integration, when we're thinking about the current challenges facing health and social care systems, we can see there needs to be something transformational, not just for the sake of the next new thing, because let's face it, the wheel was invented a long time ago. We don't need to keep inventing the wheel. What we need to do is improve on the wheels that we've already got. So it's important that we look at all the different systems and how they support each other. There's when I was presenting this, I was talking about the redwoods, which actually have very shallow roots, but they're networked. They support each other, they feed each other. And that's the strength of an integrated care approach, is when systems feed each other and support each other. There's a lot of different tools, liberating structures, which we'll just really touch briefly on today. The liberating structures users group within the Q community. Highly recommend going along to. If you've never tried any liberating structures, it's a good place to practice, and they are so helpful for creating opportunities to think about things differently, have different conversations, and move forward. And then finding that sense of common purpose about how we agree, even though we may see the world differently, how we agree on some common priorities, and we weave our ideas, skills and resources towards what we share in common. And by building those relationships, we can then have more courageous conversations across non-traditional boundaries of the things we don't share in common. So for people to be network weavers, there's specific characteristics. And I'm putting a link, again, there's a link in the chat box which takes you to a suite of resources co-designed with members of the Q community, looking at adopting the materials from June Hawley's handbook, different materials COPE Scotland had, and a little bit of other things that we've drawn from other sources, to just look at how do we nurture ourselves as a person in a network that helps that network be as effective as possible, because more people are finding, as well as the day job, they're being told to set up a network, but we're not really taught how to network. How do, on CPD, where does it come in any of our training about network effectiveness, trust within networks? So recognising the characteristics of a network weaver, seeing which one of them we identify in ourselves, and building in the ones that we think, I could develop further in that, is really helpful. And as I say, the resources shared in the chat offer ideas on how to do that. Now, These are the different skills and tasks that go along with it, each network weaver role. And I'm not going to read it all through because people can be reading them when I'm chatting. But one of the things that's really interesting is whenever you do this as a Slido, there's lots of people who identify as a connector or a coordinator. Some people identify as a catalyst and facilitator, but the lowest group that people identify with is a network guardian. And yet it's the network guardians that keep it going against the odds. And it can be a very lonely position, because sometimes you think, if I stop doing this, is it going to stop happening? Is there anybody else out there feels the same way as me? And that's why communities of practice and special interest groups and peer support groups are really helpful, because if you find that you are in a guardian role for a network, it's really helpful to also link with peers who are also in that role, to learn from each other, but also to help build that skill set in the other people who are within networks. But a lot of it's got to do with time, resources, and that's why the 15 seconds, 30 minutes, which is another resource we'll not talk about too much today, but I'll just mention it's there. If you're not aware of it, have a look at it. It's how saving 15 seconds here, spending 15 seconds here, can save half an hour somewhere else, and we could all do with an extra half hour in our day. The slides for this, the link for this again is in the chat box. And this is lids that COPE Scotland put together to share with the Q community about identifying what's the pieces that you need to support your network to be more effective. Because sometimes when we look at it as a whole, it's like, that's too much, that's overwhelming, I don't know where to start. Jigsaw lid idea is how you break that down into small manageable parts. And again, how to do that is in the chat box. This is just a reminder of the materials that we're speaking about, that again, if the link in the slide will take you to them. There's a poster if you're curious about network weaving, self-assessment questionnaire that helps you identify your learning needs if you're interested in developing yourself as a network weaver, a reflective practice workbook, and also a series of tools and resources for particular network challenges, as identified through a long co-design and production process as themes that people found common challenges within their networks. Psychological safety, spoke about trust. It is really important that we find ways to build safety within our networks, and within the materials I just mentioned, there's a whole section, and again we'll put the link in the chat box, that looks at trust within networks. How trustworthy do people view us, which is a self-reflective exercise. How much trust do we have in the networks that we're part of, because trust is the basis for any relationship, and for us to feel safe, we need to feel safe that if we share something, it's not going to come back and bite us. To learn, we make mistakes. Psychological safety is also having those safe spaces to say that didn't go to plan. And rather than worry about censure and litigation, not saying that there's not reasons why we don't have to look at safety. Of course we have to look at safety, but we also have to look at the safety of the people providing services, to be able to be honest and say why something didn't work. Because if we don't understand why it didn't work, then it's hard to find improvement so that the next time it works better. Thank you very much for your time.
Hilda, that's a tour de force in terms of network weaving. Thank you so much for that. And in particular, I think there's some really useful insights there, not least of all looking at everybody as the professional at what they're doing, and they, all have something to offer to the conversation. A lot of people don't identify with the term network weaving. How else is it known?
I think that's a really good question, and it's something that I'm looking at myself. Because June Hawley, who put together the original Network Weavers Handbook, and June was really kind to allow us to adopt and adapt her work, I feel to honour June's work to speak about network weaving. But I think some people might think, what is this network weaving? And maybe it doesn't immediately spell out what it is. Network weaving is really about how we as individuals working with others make whatever it is we're doing collectively happen in a more efficient, effective way, working across non-traditional boundaries, respecting views that's different from our own. So really, what network weaving is really about is effective collaboration, but also leadership. Because sometimes we can collaborate and go round and in circles for 5 years and not achieve anything. Sometimes it needs to be, okay, we've listened, we've went round the houses, now it's time to make some decisions moving forward. So for integration, I think it just fits in so well for working with communities and the voices of lived experience, because it offers new ways to have conversations that support change.
Okay, thank you for that. I think it's really helpful to define it in those terms, because I definitely know when I heard of it first, I wouldn't necessarily been clear as to what it was about. So I think that's really useful. And I know Maureen is, thanks Hilda. And Maureen, we'll just come to you next, but I know that you'd spoken in some of our preparation about some of the work with Virginia Mason and the NHS. Do you want to maybe just start with that? And then you might like to share some practical examples from the services here.
Sure. A huge big thank you, Juanita, and thank you to Hilda for sharing your practical experience, wisdom, tips on network weaving. So what I'm really thinking about is the NHS Virginia Mason partnership. And if you've been watching Twitter or following Warwick University, would have seen the reports. So what that was is, in the NHS, 5 trusts partnered with Virginia Mason on a 2-year improvement journey, where they immersed the whole organisation in improvement using lean methodologies. And Warwick University then evaluated how the 5 services got on over the 2-year period. And what they found was 3 excelled and 2 went into special measures. So very curiously, what was the difference? So they came up with 6 lessons. And the 4th lesson, I think, is really important to our conversation on networking, which is relationships aren't a priority. They're a prerequisite. And what we're talking about is how networking can nurture and grow those relationships. So thanks, Juanita. I think you're going to pop the link to that Virginia Mason study. There's a nice summary at that link. You don't have to read the whole big tome, but it describes the 6 lessons. So thanks for that. And it also reminds me of lots of conversations we're having in the quality world now around using a quality management system framework or approach. And lots, I think, will have been said about it. But the colleagues and friends in Scotland, and Hilda, you've mentioned them, Healthcare Improvement Scotland, have put together a lovely framework for quality management systems. And in that framework, 3 of the really essential components are building relationships, co-design and co-production. So that's the kind of the enabler for a quality management system to operate. And again, there's a little link in the box there to that. So Juanita's asked me and Hilda to share with you just some of my own personal insights in using a network weaving approach. So where did this all start? So as a Q member, I had the opportunity to do a Q network weaving masterclass series in 2020 and 21, and that's where Hilda and I first met. So I was introduced there to June Holly's book, and you'll see the link on the bottom of the slide there. And I can really remember the aha moment, kind of where I really thought something I'd been doing intuitively had a name. And it's called closing triangles. And closing triangles is one very practical way to benefit your network. So this is very simple, where one person knows 2 other people who don't know each other. And the person who knows them both can see the value in them connecting as they share common vision, ideas, or interest. So June Holly's book describes this as 7 different levels of activity. And you can see the 7 levels in the triangle, inverted triangle on the right-hand side. From suggesting A simply talk to B, or the other way around, making introductions by email, going further and setting up a conference call to introduce A and B in person, checking back, and the checking back is really important in the closing the triangles, and following up. What this does is it builds trusts, it engages talent, and it does take time. So I'm going to share with you now 2 separate little stories and 2 further ways from my experience that network weaving operates. So this is a story of twosies. So I was invited to chair a session at the 10th annual Lean Healthcare Symposium. I see lots of people from the Matter online. Thank you for bringing us that Lean Symposium last year in Croke Park in November. During the session, and I chaired this session, 4 presenters shared their research on researching lean healthcare improvement. So at this, I met Elaine Mead, who I'd never met before. She's the Executive Director at Improving Care and Compassion, on the left of the slide here, from the Highlands in Scotland. So she was the CEO of NHS Highlands. Elaine is now a PhD student at UCD, and her passion is investigating how environmental protection can be included in lean improvement work in healthcare. When I heard her speak, I immediately thought of my former colleague in the HSE, who I know has a passion for QI, Roisin Breen, here on the right. And Roisin was involved in the original setup of QPS TalkTime. So Roisin is now leading the development and implementation of the HSE Climate Action Strategy. So following a round of emails, we arranged a video call in December. Elaine and Roisin have now had further calls, and I'm linking back to meet when Elaine is next in UCD. So Roisin has now extended this Tuesday by introducing Elaine to Dr. Philip Crowley and the team, and she's now coming to present in Ireland and share her research. So a very simple story of a Tuesday in operation and the ripples that can happen from bringing people together. So a second Tuesday story is the Q Community annual event. You'll see the programme in small up on the left. On the 16th of November last year, started with networking opportunity using the liberating structure that Hilda mentioned earlier, impromptu networking. So at this, I met Tracy Broom, who's also a nurse. You can see her on the right of the slide, and a Q member. She's lead for Care Pathway and Service Delivery Transformation with the Isle of Man Government Cabinet Office. We shared experiences and identified that we were both working on enabling improvement using QI methods in national health systems for an island community, as you can see on the map. So there's the Isle of Man in the middle, me in Dublin, London with the Q, and Tracy in the middle. This time, Tracy had the idea of introducing me to her colleague, although they hadn't yet met, and a number of emails and false starts. We had a video call together in December. So in the middle, you can see Paul Moore. He's the Director of Nursing and Governance at Manx Care, which was established in April 2021 to deliver health and social care to the 90,000 people on the Isle of Man. And he's passionate about quality improvement and embedding this in health systems. We discovered Irish connections, and in fact that he'd presented in St Vincent's University Hospital at the annual audit conference when I worked there as an assistant director. So learning from our experience in Ireland and of launching the Q Community membership in Ireland, Paul and Tracy are now looking at how they can expand Q Community membership across the Isle of Man. They're just 2 little small stories about Tuesdays in operation. As Hilda has said, the handbook on page 43 and 44 of the resources Hilda talked about gives you a checklist of how to operate or a practical approach to undertaking a Tuesday. So I'm going to move on now to our next national example, and it's also an example from the Q community. So the QPS Directorate here in the NHS coordinates and co-hosts a bi-monthly tea time catch-up for Q community members who are based in Ireland. And the idea for the tea time catch-up came about because of a suggestion of one of the Q members in Ireland at an online event in 2021 when we were celebrating the first year of Q in Ireland. We followed up on the suggestion from the member for a facilitated get-together, and we asked for help for Q members to co-design it. So it's simply call every second month at 4 o'clock on the third Wednesday of the month. And we call it Tea Time Catch Up. And at the session, participants are encouraged to connect and, importantly, to offer and ask and receive support. We develop an infographic on the left in case you can't come. It's interactive and it's curated all the upcoming events from Q that people might be interested in. So we feel as people join the tea time sessions, they're more likely to return as they can see the benefits of participating and connecting. So as we know, networks are all about relationships, and relationships take time to build. So I'm going to just finish off by reminding you or telling you about a really new network that's been established. It's the Patient Safety Research Network. This is co-funded by the HRB and the HSE National Quality Improvement Team. So it's a significant amount of funding to bring together people interested in quality and patient safety research in a network together. You can see on the screen a quote from Dr. Orla Healy, who's the sponsor from the HSE for the network, and it's been led across universities, and Trinity College at the moment have advertised for the coordinator of the network. So more anon, that's a really important networking opportunity for us all, I think, in the future. So the final slide is just a little reminder, because I think what I have shared is the gift of what being a Q member has given to me in terms of networking. So there are special interest groups for network weaving, network mapping, and liberating structures, all provided by Q Community. You don't need to be a member to attend some of the special interest groups, and you might actually get a taste for all that Q has to offer, and then think about becoming a member by joining one of the sessions. So thanks, Juanita. Back over to you.
Maureen, thank you very much for that. I think it sort of shows some of the examples from a very practical perspective. And we're at a time, I think, within the system at the moment where networking probably never been more important, especially as we're looking at integrated care and building those relationships between communities and acutes further than they even have been at the minute. I'm going to hand over to Joriam now. And Joriam, we might do, I know you have a short exercise that you're going to maybe do with the group if you're happy to do so. And we'll just give people a taste of some of the stuff that we can do. Thanks.
Of course. Hey folks, it's nice to be here. I'm gonna break this format and get away from the slides a little bit and bring you closer here. The exercise I'm gonna propose is very, very, very simple, but you also notice that it's just the introduction of an exercise. You can spend an hour, you can spend 2 hours doing this exercise as much as you think is going to be useful. But right now, in 5 minutes, we're going to learn the basics. And even before we get started, just know that this is an exercise that can work for you as an individual to understand your networks. This is more or less the direction we're going right now. But you can also do this exercise thinking about a pre-existing network. Is this network connected to whom, in what way? But anyway, I know this whole talk of connections and building relationships can be a bit abstract, and you don't know where to start, you don't know how to do this, you don't know what's the next step. So I wanted to give a very clear way for you to understand what could be your next step and what you need to do tomorrow. So I need you to get a pen and paper. If you have like a notes app on your phone, that's absolutely fine, because we are going to draw something that's going to look more or less like this. This is a very simple exercise called campfires, and it's basically a quick and dirty way for you to understand who you're connected to, and for you to reflect if you're really giving enough attention to all the areas you want to connect to, if you're giving attention to the people you want to connect to. Okay, so you're going to put yourself in the middle. This is you, and those are people and also institutions and also spaces that you were connected with. And we're gonna divide those groups in a couple of different categories. So let's start with the easiest one. I want you to write 3 people that you collaborate with directly, people who work with you every day or almost every day, the people who are closest to you at work. And sure, you might work with way more than 3 people, but let's start with 3. Those are the easy ones. Grand. I'm not imagining that this will take a lot of mental power, because it's just the people who are around you maybe right now. Then let's move to another group. I would like you to write 3 names of people who are one step away. People who you have collaborated in the past and don't collaborate anymore. People who work for a different area, different division of your work. And sure, you see them, but not that often. People who have just joined you for one project last year and now they're not around anymore. One step away. Great, let's move on. And if you just thought of 1 name, 2 names, that's fine, because my idea here is to introduce you to the exercise. Okay, you will see that this is an exercise that would benefit for a bit more time than 5 minutes. Think about an hour, but you understand how it works when I get to part 2. Teaser. Okay, let's go for another group. You are not only connected to people, you can also understand your network as the institutions, as resources you're connected with. So why don't you write 3 of those exactly like you did with the people, but 3 places that you go when you need to find information. Those can be places on the internet. Those can be also people that you consult when you don't know something. Those can be resource pages. But yeah, the spaces that you go to obtain information when you don't have all the information you need. Grand. And now, just one last thing. You're also connected to more abstract things. You're also connected to your skills. You're also connected to your I don't know, vocations. You're also connected to other networks. So this can also go on this map. I would like you to add 1 unmet need or desire you have. Something that you struggle with, or you're struggling with right now, or something that you've been struggling for a while, but 1 piece there that if you could solve would make your life much easier. That's the last point in our graph, by the way. Okay, so now that you have your little web, that you have mapped a couple of key players around you, then we get to the interesting part of the exercise. When was the last time you interacted with each of those points? Write down next to the names the last time you've checked in, the last time you talked to a person, the last time you checked an informational resource, the last time that you tried to figure out this unmet need you have. And this doesn't have to be precise, okay? If you don't know if it's been 4 months or 6 months, that's fine. That's really fine. The important part here is to understand the campfires. Where are you actually placing your social energy? Where are you actually checking in? Does that align with what you want? Is it really, is it okay that you have not contacted this person for a year, or should you have? Oh, is it great actually that the last time you looked for resources was 3 days ago, or do you think you do that too much? Once you have mapped how you distribute your attention, then you can be more intentional about it. You can be like, hey, maybe I should dedicate some of this time that I'm going on YouTube to figure out this or this thing to check in with that person who I worked with 2 years ago, because they might have solutions that I don't even know, I cannot even imagine. So as you can see, we've done this in like, I don't know, 5 minutes. if you dedicate an hour to define where your campfires are at and where do you see like, oh, this area here is thriving, I really check in with these people, I really check in with those media sources, I really check in with this, great, I'm doing good here. But how about all of those campfires that are about to die? Does that person even remember me because I haven't put energy in that campfire for a while? This is a very simple, very raw way to distribute your attention. And that's it. That's a very easy first step to understand how to nurture and how to expand your networks. Where should I look for more connections? Yeah, that's what I had. Back to you.
That's brilliant. Great. Thank you so much, Joriam. And I think sometimes it can really help to put something on paper and you can visualize it, and even being aware of how long it's been since you've had a conversation with somebody, and you could have had really good contact before, but you mightn't have linked in with them in a long time, or you might have worked with somebody 20 years ago, but now they're working in a different part of the organization that might be fundamental to the work that you're doing. So it can be good to start thinking about it in that space. I'm going to pass over to John, who's going to link us in with the chat. So thank you very much to the panel, and we'll chat soon.
Thanks, everyone. It's been a real pleasure to listen to the presentations and to participate in the exercise. We've got some nice feedback in the chat again, as always, from our audience. And I think the one thing I would like to point out, I'm not sure if we've had someone from Peru before, but we certainly have someone joining us today from Peru. So Juan Limo Isqua Fellow, I think, is joining us from Peru. So you're very welcome. I see Juanita welcomed you earlier, but it's very nice to have international guests visiting us. And lots of good feedback to your question at the beginning, Juanita, around the importance of networks rather than doing everything yourself. And Sheena Farrell saying networking or community practice is essential for support, and she's with the National Dementia Service. And another comment from Anne Byrne is about networking is the long game. And I think for me that's a really interesting kind of place, and I might, I'm going to invite some further questions from our audience, but I might get started with a question just as I was listening, to the three of you talk. I think there are values and beliefs, I think that are behind, how much you would value the idea of network weaving. And I was wondering if you might talk a little bit about those things, like, Maureen, you said that the importance of relationships. So I might just share that, what are the underlying beliefs that are really important for us? And maybe that's where we need to work. And I suppose the second part of my question is, how do we work on that, with our leaders in organizations and our everyday leaders? So Maureen, I might ask you first to give me some thoughts on that. Just what are the beliefs underlying, the importance of network weaving?
I think one of them, John, is, the absolute belief in human potential.
Mm-hmm.
I think that's kind of a founding value in what it's all about, and taking that positivity. We can do it. As humans, we have phenomenal potential, but we really need to work with each other in that phenomenal potential. None of us would be able to work in isolation. And I think the other one I think that is really, really important is the never giving up principle, that hope and optimism. And there are curveballs for everyone. And it's easy to say, oh, it's too difficult, I'll give up, I'll do something else. That's not going to flourish. I think that's the other very important principle. So human potential, optimism, hope, and never giving up.
Fantastic. Yeah, that's great. And Hilda, I might go to you for the same thing. What are the what are those beliefs that are so important to getting people to invest in network weaving?
Thanks. Resonating with what Maureen said, there's something about not giving up. So quite often networks are formed because something's going to change, and there can be different responses to change, and sometimes change can take a long time. So if you're a network leader, as I mentioned earlier, it can be quite lonely, but there are others out there who share a vision of a better world too. And that perseverance and commitment to keep going against the odds, to be curious, to seek out other people who maybe their vision of a better world, kinder world is different from yours, but their drive to make a difference is the same. Going back to the exercise that Joriam did there about the importance of the relationships and the resources we have to tap into for our social energy. We all know about the problems we've got just now with people in countdown to retirement, hating the job, wanting to go and do something else. That doesn't inspire us. Whereas when we are inspired, we believe against the odds, we can make a difference. So in terms of values, I think it's people are driven to make a difference. They're driven to make things work with others to make things better. And despite the odds, we'll keep going and meet others who also keep going and energize each other to make a difference. And be curious and also be humble. Realize that the more you learn, the less you know.
That's super. Thank you. And Joriam, the beliefs again, that are so important, I think, for us all to, and maybe these are the things that we need to work on at the same time as we're starting to build our networks. Is these fundamental beliefs that these are important things to do.
Yeah, I think it's very easy for a crowd to agree. Let's say 1,000 people to agree. Oh yeah, building relationships with others is really important. Who would ever argue against that? But it's work, folks. It's work. So the more we understand that this is part of what we need to do, this is part of the work, this is part of the job, this is part. Honestly, this is more than the job. This is part of family work. This is part of like your being part of a neighborhood. This is work. The more we can be effective at it, because we all agree. We all agree that those relationships should be nurtured and that we should be more people focused. But how does that manifest outside of just our abstract thinking? How does this manifest into the world? Today we gave like the tiniest tip of the iceberg, but those are skills that can be improved. You can be good at this. You can be excellent at this. So the more we understand that those skills can be trained, the easier this all gets.
Great, thank you. And a comment there from Juan Limo, from our colleague joining us from Peru. I would say the most valuable idea of networking is building a distributed leadership for QI and patient safety to advance and make things happen. And I think that the value of having, like you said, leadership in this area can be a lonely position. So having a network is a very valuable thing, to help with that. Any tips, anybody, for everyday things that leaders can do in terms of making this important? Because I think we all recognize this as important, but it doesn't, perhaps I would say, at a system level, get the attention and the prioritization that it does. Anything that we can do tomorrow, at senior level and at everyday leadership levels?
John, I just noticed Hilda popped in the chat box there. These are the lovely promises that the group who were working on network weaving put together as how network weavers operate. And Hilda, thank you for reminding me of that. And the image has a beautiful web behind it. But just in case anybody misses them, they're there in the chat box. 1 to 10 lovely promises. So if we could encourage leaders to use those promises, we'd be making phenomenal progress, I think. And they're all on one lovely card.
I think one of the things as well, following on from that, is find a shared vision. It goes back to what Joriam was saying. This is work. One of the things that leaders can do is recognize the value of deep work. So shallow work is preparing a presentation, delivering a presentation. Deep work is going away thinking, how did that land? How can I use that? Who else do I want to talk to about that? What relevance does it have? And we don't have enough time in the day job to think, to do the deep work about why are we doing this? What's our vision? Is it a vision that we all share, or does it descend from on high and everyone else has it as a 3-line whip to go along with? So creating space for meaningful conversations, understanding people in your teams. What's your dream? Why did you start doing? You know, rather than introducing yourself with, oh, I'm the CEO of Cope Scotland, it's like, I want to work with others to help build a kinder world. That's who I am. Like a stick of rock, it's hardwired through. And it's about taking that time to understand from other people, what floats your boat? Why do you do it? Now, if it's like, I want promotion and I want to earn more money, that's fine. There's nothing wrong with that. But if we understand each other better, what drives us, what motivates us, then that helps build the relationships we need for change. And that's a conversation that can start tomorrow. Taking time to really get to know each other and what makes us float.
That's super, and I love the I love your list there of 10 things, and I'm just looking at them, and they are all everyday things, really, aren't they? And you know, that they are things that we can all do. And I'm struck again by the sense that you know, we need networks for energy, and we need energy to make the changes that we see happening. Joriam, any last thoughts from you, or any last tips and recommendations?
My last tip is, this work is infinite. Don't overwhelm yourself. Think of a very manageable amount of time you're going to spend every week doing it, because those two factors are important: rhythm and control the levels of energy. So if you tell yourself, I'm going to work 5 minutes per week for the next 2 months to build my networks, that is already great progress, because you can establish a rhythm. Later, you can do more, do less if you want. But yeah, find what's manageable for you, because this work is always useful, but it's infinite.
Great. And Maureen, any last thoughts from you?
Well, I wouldn't be me if I didn't say, if you're not already a Q community member, seek it out today, because it has really, really helped me and given me so many wonderful connections and networks. Thanks, John.
Thanks, Maureen. And we might put up the next slide there, just while we're talking about this, because I think people have mentioned this already. If you're interested in learning more about networks and network weaving, this would be something that might really fill that space. And so this is a special interest group hosted through Q. And again, you know, we would love everybody to become a Q member, but you don't have to be a Q member necessarily to join these groups. And it might be a way of whetting your appetite and seeing what Q membership could give you. So there are some dates there for the next couple of meetings. Joriam, do you want to say anything about that group?
Sure. Just so you folks know, the links are in the chat. If you just scroll a little up, yeah, as John said, you don't have to be a member. So I would like you to come to us and get value out of the community, and then of course you're going to choose to be a member once you understand how useful it is. So we have groups for all sorts of areas of interest. You can join 99% of them, even as a guest, and we also have a very active calendar. Please come. It's all free.
Great. And I know, Hilda, you're involved with this group as well.
Yeah, and I've popped my email in the chat box. So if anyone wants to follow up on anything from today, genuinely, I mean it, just drop me an email. More than happy to ask any further questions.
That is super. Thank you. I want to thank our panel so much for your presentations and your thoughts and all of your wisdom. And thank Juanita for hosting the introduction and the panel discussion. Please do follow us on social media, including X, and follow up with our YouTube channel if you missed the presentation. Thank you, and bye-bye.